Well, thank you, Nathan. And in its continued commitment to offer services that improve the health and well-being of our communities, Carle Health is offering free lung cancer screenings to eligible members of the public this weekend.
That's right. And here to tell us more about the importance of these potentially life-saving screenings is Dr. Tony Shadid, a diagnostic and interventional radiologist. Thanks so much for being here this morning.
Thanks for having me.
Of course.
Yeah.
So first, who is eligible for a lung cancer screening?
Well, patients who smoke, who have a significant smoking history of at least 20 pack years and are in the ages of 50 to 80 years old. And a pack year is defined as 1 pack per day for how many years. So if you smoke 1 pack for 1 year, for 20, or 1 pack a day for 20 years, that's 20 pack years. If you smoke 2 packs a day for a year, then that's for 10 years, that's 20 pack years. So
wow.
I mean, it's a significant smoking history.
Right.
So why is it important to get screenings for lung cancer?
So lung cancer is a very devastating disease. It's when it's diagnosed, it's difficult to treat, and it's got a high mortality rate. So in the United States, it's the #1 cancer killer in our country, despite the fact that it's the #3 cancer in our country, behind skin cancer and breast cancer.
Wow.
But despite that, it's when it is detected and detected early, it can be treated successfully.
So what exactly does it look like to get treated, to get tested? What does the rundown of that look like?
So we offer low-dose CT scans, and what that is, it's a CT scanner, just like you would a normal one. Patients come in, they can have on their work break, before or after work. It takes no prep, there's no IV, there's no sedation. They come in, they sit on the scanner, they're scanned, and it takes about 5–10 minutes, and then they can go on with their daily life. The images are reconstructed through a computer, and they're interpreted by a radiologist for detection of lung nodules. And those lung nodules are the ones that would be otherwise not detected symptomatically, and so that's where being able to detect them early is when treatment can be initiated at an earlier stage more successfully.
Now, I've never had a CT scan, but you're talking about how quick it is. Do I even have to change into a gown, or do I just get to go? I mean,
Yeah,
how does that work?
No,
I mean, you make it seem so easy.
Well, you could, just like what you're wearing now, you could go in, as long as you're not bedazzled.
Yeah, a bunch of metal.
I know you guys look like you might have some jewelry or something, but you might have to take that off. But otherwise, no metal on the chest. But yeah, in your street clothes, and so you can just have it done as is.
So for those who want to utilize those resources to make sure they can get that lung cancer screening, or if they don't have time to do it on a specific day, exactly how can they make sure that they're protecting themselves?
Well, first off, try to stop smoking. I know it's difficult, but that's the first thing, is try to stop smoking. But if you are smoking or have smoked, then that's where you want to call your primary care physician. But this weekend, we're having a free cancer screening at Pekin and Proctor from 8 a.m. till noon. And you can call the number, I believe it's on the screen. And you can
get it on the screen for you soon.
Yeah, it's you can call that number and you can talk to a specialist, lung care specialist, and then they will get you set up with a free cancer screening test. But if you can't make it this weekend, that's all right. You just call your primary care or call that number again and get set up for another time that's more convenient for you.
This is a free and easy way to get one thing off your mind, one worry off your mind. Who wouldn't want to know? I know it can be scary to get started, but if you don't know what you don't know. So this is a great opportunity for that. All these details, because we don't want you to miss it, I know we talked a lot, on our website, ciproud.com. Please make sure that you check out this information, especially if you have a history of smoking.